Welcome back to part 7 of our 100-part CPC exam series. Today, we're grabbing our clinical blueprints and mapping out the structural framework of the human body. Think of this explainer as your ultimate anatomical map to coding success.
I am absolutely thrilled to have you here as we conquer the musculoskeletal system. Let's set a really high energy tone today because this material is incredibly foundational for your exam. And of course, before we jump right into the anatomy, make sure to like, share, and subscribe to Decode Healthcare with Harshal.
All right, so here is today's agenda. We'll cover our musculoskeletal coding overview, bones and skeleton regions, joint classifications and movements, the strain versus sprain rules, pathologies and surgical terms, and then we'll wrap up with a summary. Section 1, Musculoskeletal Coding Overview. So listen, in musculoskeletal coding, being vague absolutely does not pay. Your code selection is driven by hyper-specific clinical details. We need exact bone and joint identification. We have to know the specific fracture patterns, like is the fracture open or closed? Is it comminuted, which just means fragmented, or is it displaced versus non-displaced? Furthermore, missing a tiny detail like laterality, whether an injury is on the right or left side, or misunderstanding a procedural technique can literally lead you to an entirely wrong code and a denied claim. We definitely want to avoid that. Section 2, Bones and Skeleton Regions. First up, let's talk about the bones themselves. On the left, we've got compact or cortical bone. This is that really dense, hard outer shell that gives your bones their incredible strength and protection. On the right, contrast that with spongy or cancellous bone. This is the porous inner structure that houses the marrow spaces. Now, inside those porous spaces is where the magic actually happens. We have two types of marrow. Red marrow is basically the factory. It's responsible for hematosis, which is just a fancy word for blood cell production. Yellow marrow, on the other hand, acts as a fat storage reserve, though it can actually convert back to red marrow if the body desperately needs it. Zooming out a bit, we divide the skeleton into two main regions. The axial skeleton includes your skull, your vertebral column, and your ribs. Its main job? Protection and posture. Meanwhile, the appendicular skeleton includes your limbs, plus the shoulder and pelvic girdles. These are designed specifically for movement and support. Section 3, Joint Classifications and Movements. Joints are classified by how much they let you move. Synarthroses are totally immovable, like the sutures in your skull. Amphiarthroses are slightly movable, like your intervertebral discs. But the ones you'll be coding the most are diarthroses, or synovial joints. These are your freely movable joints, like your knee, shoulder, or hip, which contain cartilage and synovial fluid. Okay, to keep these joint movements straight, you have got to remember the classic soup mnemonic for the forearm. Supination is turning your palm up like you're holding a bowl of soup. Pronation is turning your palm down like you're pouring that soup out. Seriously, lock that visualization in your mind. It is an absolute lifesaver on the exam. Here are a few more critical movements you need to visualize. Flexion decreases the joint angle, like bending your elbow. Extension increases it, straightening the limb out. Abduction is moving a limb away from your body's midline, while adduction is bringing your arms back toward your body. A great trick is to remember adduction is adding it back to your core. Finally, rotation is the pivoting of a bone on its own axis, kind of like shaking your head no. Section 4, Strain versus Sprain Rules. Pay close attention here, because these sound incredibly similar, but anatomically, they are entirely different. For a strain, remember the T. A strain is an injury to a muscle or tendon. A sprain, however, involves a ligament. And to remember that, just think, ligaments link bone to bone. Do not let the exam trick you by swapping these two definitions. Section 5, Pathologies and Surgical Terms. Let's look at arthritis for a second. Osteoarthritis is characterized by degenerative wear and tear changes on the joint over time. Rheumatoid arthritis is completely different. It's an inflammatory autoimmune disease with systemic involvement. Your code selection changes completely based on the clinical logic between degenerative wear and tear versus systemic autoimmune conditions. Now let's rapidly run through some critical surgical definitions you absolutely need to memorize. ORAF means open reduction with internal fixation. That involves literally opening the site and using internal hardware like plates and screws. External fixation, conversely, uses pins and a structural frame on the outside of the body.
Arthroscopy uses a minimally invasive camera scope inside a joint for diagnosis or repair, while arthroplasty is a total or partial joint replacement, and osteotomy is the surgical cutting of a bone, and a laminectomy removes part of a vertebra to relieve devastating spinal pressure.
Section 6, Summary and Next Episode.
Here is your master summary to lock everything in. This distills the absolute highest yield musculoskeletal rules for your exam prep. Review those bone types and marrow functions. Master your joint mobility classifications. Remember the critical T and strain for tendon, and know the exact procedural difference between your ORIFs and your external fixations. If you master these, you are going to master the musculoskeletal section.
Well, you're now fully equipped to decode musculoskeletal documentation. But think about this for a second. What happens when coding rules are dictated entirely by the direction of blood flow? Next time, in Part 8, we are taking on the cardiovascular system, mapping out heart chambers, valves, and complex circulations. You definitely won't want to miss it. Until then, keep decoding.